My name's Ethan,
My name is Brendan.
and today we're just going to be doing a short PowerPoint on therapeutic milieu. So, for the definition, what is therapeutic milieu? It refers to a structured, supportive environment designed to promote mental and emotional well-being. So, it is an intentional setting where every aspect of the environment, physical space, social interactions, routines, and staff engagement is designed to contribute to healing.
And why may it be important, you ask? Mental health recovery is not just about medications and therapy. The environment also plays a huge role in stabilizing and supporting individuals. Patients in crisis or long-term care often experience stress, fear, and disorientation. A structured and safe environment reduces distress and fosters personal growth. Research shows that a well-maintained therapeutic milieu decreases aggression, enhances treatment adherence, and improves overall patient outcomes.
Here we have some key components of therapeutic milieu. So, number one is a safe, comfortable, and structured space can reduce stress and agitation. And then number two, uncluttered spaces with soothing colors, natural light, and minimal noise. Then we have comfortable furniture in designated areas for therapy, relaxation, and recreation. Then we have safety measures like locked units, rounded furniture, and emergency protocols, wherever that may apply.
The kind of social climate that you want to build in a therapeutic milieu type of situation, you want one that is incorporated of trust, cooperation, and accountability. This will strengthen relationships and enhance patient care. Staff can model respectful communication through active listening and constructive feedback, setting a positive example for others. Encouraging peer support creates a space for shared experiences and mutual encouragement, which accelerates personal and collective growth. Consistently cultivating these behaviors helps create an environment of healing where individuals take responsibility for their actions and contribute to the well-being of others as well.
Then we also have emotional support, which ties into your therapeutic milieu. Providing empathy, validation, and encouragement helps patients feel heard and valued. So a non-judgmental and patient-centered approach is key. For example, active listening techniques, trauma-informed care, and crisis de-escalation training would be an example.
A lot of therapeutic milieu is getting rid of that anxiety and fear of day-to-day life, as well as structuring their days. A structured routine with a daily schedule and therapeutic activities promote stability and predictability for patient outcomes. For example, they have structured group therapy, and that occurs at a routine time throughout the day during their stay. We also want to have their psychoeducation sessions, art, music, therapy, and recreational activities scheduled throughout the day so that they are consistent and they know what is going to happen. Meal times, rest periods, and social hours are also scheduled to create rhythm and normalcy.
Then you have your patient involvement. So empowering your patients in their treatment fosters a sense of control and autonomy. Encouraging patients to set personal goals, make choices, and engage in decision-making about their care promotes self-efficiency. For example, community meetings where patients provide feedback on their experience.
Benefits of therapeutic milieu. It improves patient engagement and adherence to treatment when we get rid of that high level of stress in their care environment. So patients in a supportive environment are much more likely to participate in their day-to-day activities than someone would to be in a less structured and less therapeutic environment.
Therapeutic milieu also reduces aggression, anxiety, and isolation. So it kind of ties back into where we talked about creating a structured environment, like, just having the same day-to-day plan. So it reduces anxiety about, unseen circumstances. So a structured setting reduces uncertainty, preventing conflicts, and helping patients feel secure. Again, that ties back to the last few slides.
Being in a therapeutic environment enhances coping skills for patients, as well as self-awareness. When you're exploring yourself in group therapy so often, and with the same set of individuals, building a trustful relationship with those who are not only counseling you, but those who are going throughout the treatment with you as well, it's a lot easier to have a sense of self-awareness of what's changing, as well as building relationships with others, and they can kind of give you some insight into what may be happening with you as well. So therapeutic activities and peer support encourage emotional regulation and personal insight.
So another benefit is that it promotes a sense of community and belonging, especially in the workplace. Patients feel less alone when they engage in a meaningful social interaction.
Staff training in trauma-informed care and active listening. Mental health professionals should receive training in de-escalation techniques and compassionate communication. This helps foster a sense of trust and build rapport with your patients, which will help them want to communicate with you, as well as adhere to their treatment. Understanding trauma history in our patients helps staff avoid triggers and provide personalized care based on each individual patient's background.
Group therapy and recreational activities also plays a big role. Therapeutic groups, mindfulness sessions, exercise programs, and creative outlets such as art and music play a vital role in fostering emotional expression and social bonding with mental health settings. These interventions contribute to the overall well-being of individuals by addressing psychological, emotional, and social needs.
Peer support and positive reinforcement, those are a key factor in therapeutic milieu, because we're really relying on our patients to not only trust the clinicians and other staff in the facility, but to also trust the other patients who will be working with them. So peer-led discussions, mentorship programs, and patient councils can be powerful tools in creating a supportive community where individuals share experiences, gain motivation, and most importantly, feel understood by the staff and other patients. In all three models, peer-led discussions, mentorship programs, and patient councils, the sense of shared experience and mutual support helps build a stronger foundation of motivation, encouragement, and healing. These connections foster a deeper understanding of each individual's journey and provide a collective strength that individuals can rely on when they face challenges.
Designing calm spaces. So research shows that certain colors like blues and greens promote relaxation, while harsh lighting can increase agitation. You'll see in our hospitals, those are a lot of our colors, especially in like mental facilities. They use a lot more of the blues and greens. Then you also have your nature exposure. Indoor plants, outdoor walks, and window views reduce stress and enhances mood. I know sometimes in facilities they'll take their patients like outside when it's like a nice day, or I mean, they used to. I'm not sure if they still do, but or they'll allow them to look at a window, like out through the window, or most of their rooms will have a nice big window just to let some light in.
Sometimes walks around the unit, wheelchair rides, as
Yeah.
well as just having a sense of plant life in the hospital.
Mm-hmm.
I don't know about your facility, but where I work, we have lots of plants.
Yeah. It's mainly just making the patients still feel connected with the outside world while they're still going through the things that they're trying to overcome.
Challenges in maintaining a therapeutic milieu. Staff burnout and compassion fatigue. These are huge issues everywhere in healthcare,
Yeah.
as sometimes it just gets a little bit tiring being a caretaker and constantly giving to other people's needs,
Yeah.
wearing a smile when things get hard, being there for people when they're in the hardest parts of their life. It can be very, very straining on our staff members in every unit, mental health especially, as the stress and anxiety levels your patients may experience in their hard days are just a little bit tougher.
Mm.
So mental health professionals work in a high pressure environment where they manage complex cases, high patient acuity and load, and emotionally demanding situations. This, in turn, leads to staff burnout, compassion fatigue, and reduced job satisfaction, ultimately impacting patient care quality. Because when the staff is burnt out, how can we be expected to give the highest level and standard of care to our patients when we're too burnt out to even care for ourselves at times?
Mm-hmm. Just for a quick example, whenever I was newer to my CNA job, I was working in the emergency department, and I was taking care of a patient, and the patient had soiled themselves, and I was trying to find help in the emergency department to clean up the patient, and I asked the nurses, and they kind of just laughed and said that they could tell that I was newer and that I still had that compassion, because not saying they didn't have the compassion, but you could just tell that they were really burnt out. So I feel like staff burnout is a big issue in the workplace. So we also listed some solutions to the burnout. Brief daily or weekly meetings to discuss challenges and share emotional responses to difficult cases. So one-on-one sessions with a clinician, right, help staff navigate complex cases and emotional challenges. Providing staff with counseling or employee assistance programs can support their psychological well-being. Implementing protected break times prevents overworking and promotes mental clarity. So, especially in healthcare now, I know a lot of facilities have their own helplines or websites you can go onto. And if you're an employee, I believe you get 5 free visits. So I think it's something that's really acknowledged, and we're trying to work on a better outcome for it, but we're still heading in the right direction.
Managing patient conflicts. In any sort of inpatient care facility where patients interact with staff and or other patients, at some point in time in those high stress environments, there is due to be some sort of patient-on-patient due diligence or some sort of conflict between the patient and the staff. It's just how it goes. We have conflicts every day, and that doesn't stop when we're in the healthcare scene. So patients with severe psychiatric conditions, they're even more high prone to these sort of interactions due to the high stress environment that they endure day to day, just living with their illness. So these psychiatric conditions that can lead to more patient conflicts include schizophrenia, bipolar disorder, borderline personality disorder. And these patients, they often struggle with emotional regulation. And this can manifest in impulsivity, aggression, anxiety, and withdrawal from our patients.
And those are all things you don't really want in the healthcare scene. So we also came up with solutions to support emotional regulation. We must establish structure, predictability, and accountability, helping patients understand expectations and consequences. Just talking to them. Daily or weekly discussions reinforce expectations, encourage patient involvement, and address conflicts proactively. Staff should apply behavioral guidelines uniformly to maintain fairness and trust. Patients agree to specific guidelines outlining appropriate behavior and coping strategies.
Environmental constraints in our mental health facilities. They may include limited space, as sometimes we have a higher patient acuity than what we are even given the space to take on. So sometimes that can be seen in the form of dual patient rooms, patients out in the hallway, extra spaces in our emergency departments, and all in all, just too many patients in too small of an environment. Our funding and resources can also affect the ability to create an ideal therapeutic setting, because sometimes we don't have the funding nor the resources to take on not only the amount of patients that we have, but maybe to even take on patients with higher mental health conditions that may take funding and resources that we are not given or have access to at the time.
Or even more than normal patients.
So solutions, we want to maximize our available resources. We also want to advocate for our patients and try to get some more funding and incorporate low-cost therapeutic strategies as well, which Therapeutic Milieu falls along those lines, if you ask me.
We have some key takeaways from the PowerPoint and just Therapeutic Milieu itself. A therapeutic milieu is essential in mental health care. It's not just about therapy sessions, but the entire environment that supports healing. So just like we talked about, lighting up the environment for the patients to help them get through their darker days, such as like the brighter colors, plants inside the facility, open windows, just doing anything to make the patient feel more connected. By focusing on safety, structure, and emotional support, we create a setting where individuals can recover and grow. Really, that's about all we have.